Hello, my name is Sean, and I'm with Rez, and we're here to interview you about schizophrenia. But first, can you tell us about yourself?
Hi, my name is Lisi, and I've been a registered nurse for over 17 years now. My experience with mental health has been years ago, but I could still probably be able to answer questions about it
Okay,
and give you some general information.
okay, sure. For the first question is okay, how many times do you encounter people who suffer from schizophrenia yearly?
So the information I have here it's a data that I got from Regina General Hospital in the psych unit. Schizophrenia affects 1 in every 100 Canadians, and I've also found other research that every year Canada sees about 25.9 new schizophrenia cases per 100,000 people. But there's really no conclusive national statistics on the prevalence of schizophrenia in Canada.
All right, for the second question is, what is the most common age that schizophrenia usually occurs in?
Where does schizophrenia begin? Usually, it strikes young people for the first time in their late teen or early 20s. It occurs in all races, cultures, and social classes, and both sexes equally. And it also generally occurs in males at an earlier age, but usually, this is not a rule. The onset of schizophrenia is usually gradual. It gradually builds up of symptoms which may or may not lead to an acute or crisis episode. Sometimes it's rapid or sudden onset. Usually it strikes quickly with individual experiencing dramatic behavior changes in a matter of few weeks or even days, which is usually followed by an acute episode.
Okay, for our third question, can someone get schizophrenia from a traumatic event that had happened in their life?
Well, schizophrenia is a medical illness of the brain. It's not caused by a split personality, or I mean, it's not a split personality. It is not caused by bad parenting. Most people with schizophrenia are not violent, and it is not the result of a childhood trauma.
Okay. How are drugs connected to the development of schizophrenia?
There are no medications that cause schizophrenia. It is not caused by any medications. The cause of schizophrenia is an imbalance of two substances in the brain, and these substances are called dopamine. There's too much of this chemical in certain areas of the brain, and the other one is serotonin. There's new evidence shows abnormally high serotonin levels may play a role in the illness as well.
Okay, for our last question, have you ever had any experience of a patient miraculously being cured from schizophrenia?
No, there is no cure for schizophrenia, but it can be successfully treated and managed. When treating schizophrenia, we could use medications called antipsychotic medications. We can also use psychotherapy and social support. We also have electroconvulsive therapy, but it's not usually recommended for the treatment of schizophrenia. Sometimes these are used in people who are severely disorganized and do not respond to medication, that are catatonic and severely depressed or agitated. There are also non-prescription drug use like caffeine. Caffeine may intensify the side effects of prescription medications. So there's really no cure for the schizo, but we can manage it. So these people with with this illness